In spite of all the developments which have been happening over the last several months, the only specific recommendations for treatment is symptomatic treatment with paracetamol and supportive oxygen when a person develops hypoxia. The hypoxia is also known as happy hypoxia or silent hypoxia because people don't realize that they are breathless till quite late in the course of the illness. That is why it is recommended that when you develop symptoms, you need to seek medical help to see whether there is a possibility that you are suffering from hypoxia, and we advise people to use pulse oximetry to check the oxygen levels. I want to reiterate that the pulse oximetry is not for healthy people. So there is no need for all of you to buy the pulse oximeter and keep checking yourself every day. This is only in people who are symptomatic. So people who are running temperatures, people who are having coughs, people who are having severe body pains lasting more than 4 or 5 days, they need to check the oxygen saturation to see whether the saturation level is more than 94. Anything above 94 is acceptable, and home isolation is what is recommended. If the saturation consistently starts dropping to less than 94, you definitely need hospital help and probably oxygen support. Apart from this, there are several agents which have been used, which include anti-clotting drugs like heparin, because it is believed one of the complications of COVID is that clots tend to form in the small blood vessels, especially of the lungs, which may affect oxygen transfer. So anti-clotting medicines like heparin. We also have started using steroids in certain cases where their oxygen saturation is dropping and they may require supportive oxygen. Such people, if steroids are given at the right time, then they seem to respond well. Apart from this, antivirals, there is only one which is so far been shown to have some benefit, what is known as remdesivir. This remdesivir probably shortens the duration of illness but has no mortality benefit. But this is the only one we have. All the other agents, including oseltamivir, including lopinavir, ritonavir, interferon, and even the favipiravir, which has been recently launched with a lot of pomp, has shown no significant benefit in treatment of COVID-19. So treatment is to ensure that you access care early so that if you require oxygen support, you can start it early. The idea is to have various means of oxygen delivery so that we avoid putting a patient on a ventilator. Once the person lands up on a ventilator, the outcomes can be poor. So we try to give oxygen in different ways to ensure that we can avoid putting the patient on a ventilator. We also try, as I said, anti-clotting medicines, steroids, and remdesivir if it is available. Even remdesivir is currently believed to be useful only in a trial context. It is not yet recommended as a treatment of choice. So these are the modalities. As far as prevention goes, the ICMR has recommended hydroxychloroquine as an agent to prevent infections in people, household contacts of COVID positive cases, or in healthcare workers who may be handling COVID patients. But there is very little medical evidence to say that this works. I'm still not sure whether the ICMR has robust data on this. There are a couple of papers, but I have my own reservations on the benefits of hydroxychloroquine in preventing the condition. Definitely hydroxychloroquine is not for the common public. It is only for household contacts of COVID positive cases and healthcare workers who are looking after COVID. The others don't require hydroxychloroquine.